Hi, my name is Dr. Steve Salzbrenner. I'm an assistant professor of psychiatry at the University of Nebraska Medical Center, and I recently published Prior Authorization of Medication and its Influence on Provider Behavior, a latent class analysis, in the Journal of Medical Internet Research. In our paper entitled Prior Authorization of Medication and its influence on provider behavior, latent class analysis, we explored whether prior authorization affects clinical decision-making in certain ways, and specifically whether there are certain classes of providers who can be identified who are more or less likely to engage in these behaviors. And we did find that the behaviors, which include changing medications due to prior authorization delays, avoiding newer medications altogether due to prior authorization delays that are anticipated, or changing a patient's diagnosis in order to meet prior authorization criteria. Those three behaviors were more likely in certain types of providers. They included providers that tended to be younger, that had a higher patient load, and in our study, they are about twice as likely to be psychiatrists. Of note, we did oversample psychiatrists in this particular study because that's my personal specialty, and I was most interested in that population. What we found, the implications, the practical implications of these findings are that insurance companies need to know that there's not a one-size-fits-all approach to how providers handle prior authorizations. And so perhaps a better understanding of the subgroups would help insurance companies to approach the situation in a way that is least likely to lead to clinical decisions that might be detrimental to patients and public health in general. We chose to submit our research to the Journal of Medical Internet Research because it seemed topically to really fit our area of interest and was quite influential with the high impact rating